Coronavirus is an illness caused by a virus that can spread from person to person. The virus that causes COVID-19 is a new coronavirus that has spread throughout the world. Despite the widespread awareness regarding COVID-19, many are still unaware about how it affects the human body. According to the World Health Organization, most people who contract COVID-19 only experience mild flu-like symptoms. Occasionally though, the infection can evolve into a severe case pneumonia that can be lethal, especially for older people and those with underlying medical conditions. So now, how does COVID-19 affect you? The virus enters the body through the mouth or the nose. From there, the virus makes its way down into the air sacs inside your lungs, known as the alveoli. An alveoli is an important part of the respiratory system whose function is to exchange oxygen and carbon dioxide molecules to and fro the blood. Once in the alveoli, the virus uses its distinctive spike proteins to hijack cells. The primary genetic programming of any virus is to make copies of itself, and COVID-19 is no exception. Once the virus RNA has entered the cell, new copies are made and the cell is killed in the process, releasing new viruses to infect neighboring cells in the alveolus. This process can occur initially without a person being aware of the infection, which is one of the reasons COVID-19 has been able to spread so effectively. The process of hijacking cells to reproduce causes inflammation in the lungs, which triggers an immune response. The immune system may respond with symptoms including fever, a cough, shortness of breath, chills, sometimes with shaking, body aches, headache, a sore throat, even loss of taste or smell. Some patients may even experience diarrhea. These symptoms are usually mild and begin gradually. Some people become infected but only have mild symptoms. About 80 to 85% recover from the disease without needing hospital treatment. In 15 to 20% cases, the immune system's response to inflammation in the lungs can cause what's known as cytokine storm. This runaway response can cause more damage to the body's own cells than to the virus it's trying to defeat. So basically, it is the overreaction of the immune system that causes more damage to the lungs. Therefore, if enough alveoli in the lungs collapse, a patient is to be placed on a ventilator. In the most severe cases, systemic inflammatory response syndrome occurs as the protein-rich fluid from the lungs enters the bloodstream, resulting in septic shock and multi-organ failure, which in most cases lead to death. Thankfully, COVID-19 isn't a death sentence for most people who become infected, but the symptoms described are not pleasant. Until a vaccine is developed, the best defense is avoiding infection altogether through frequent, thorough hand washing and physical distancing as recommended by health authorities. Since there is no current treatment or proven vaccine for COVID-19, social distancing is the most effective way to slow down the spread of the virus. It is also important to stay healthy, making a routine of eating a well-balanced diet, drinking plenty of water, getting enough sleep, exercising, and monitoring your mental health. Another important thing we can do is to stay informed. With a situation that changes daily, it is crucial to stay informed so that you can know if any changes have occurred both globally and in your community. Make sure to look for evidence-based source to avoid misinformation. So thank you for watching this video. Stay tuned for the next video where I'll be talking about the alternative treatments that are currently being used to treat coronavirus.